afternoon.
My name is Penohia Nacho, and I'm an MPH student, and I'm under the supervision of Prof. Ogaji. These are my outlines. My background. So, primary health care is the foundation of Nigerian health system.
What is your title? Did you tell us your title?
Sorry. The title is Exploring the Impact of Basic Healthcare Provision Funds Implementation on Primary Healthcare Performance in Kaduna State. Background. Primary healthcare is the foundation of Nigerian health system, yet it continues to face challenges including inadequate funding, staffing, and equipment. The basic healthcare provision was established under the Section 11 of the National Health Act 2014 to strengthen primary health care through dedicated financing. However, despite the implementation of the basic health care provision funds, challenges remain at facility level in Kaduna State. And this actually motivated me to examine whether this implementation of the funds is translated into the improvement of primary healthcare performance. The problem statement. The problem is actually there is a gap between the primary healthcare provision fund policy, the funding, and what's actually happening in the primary healthcare facility. The study's justification. Although the Primary Healthcare Provision Funds was introduced to strengthen the primary healthcare financing in Nigeria, challenges such as drug stockouts, non-functional equipment, weak community accountability still exist. There was a need to actually assess whether this was actually if this was translated
You have 7 minutes more.
into improving the healthcare performance in Kaduna State. My aim was to explore the effects of the basic healthcare provision funds implementation on the primary healthcare performance in Kaduna State, and my objectives were one, to determine the availability of the drugs, to assess the functionality of essential equipment, to examine the community accountability, including the World Development Community, to identify the barriers and the facilitators influencing the basic healthcare provision funds, to determine the effect of the basic healthcare um, provision funds on community members. My study area, I used three local governments in the senatorial zone, where one is Sapongari, which is the urban area, Kachi, which is the semi-rural, and Chiku, which is the rural. My study design is convergent parallel mixed method, where I combined quantitative cross-sectional survey, qualitative multiple case study, and also integration. My study populations are facility managers, frontline health workers. They were actually facility managers, frontline health workers, that's the nurses, the midwives, the CHIO, then also the World Development Committee. Inclusive were the public-owned facilities that were there for at least more than one year, facility operational staffs that were also there for also more than 2 years, health workers in the post, and also the World Development Committee. I excluded the private owners and also those that had not been in the system for like less than 1 year, and also the cleaners, the non-clinical staffs. My sample size, I use Crocam formula, where my confidence level was 1.96. My estimated proportion was 0.5, because there was no prior stated wide estimation existing, and then my complement proportion was 1 minus p. My margin was 0.05, and I amounted to minimum sample size as 385 health workers. My sampling method, I use three-stage multi-staged sampling techniques, where the first stage I use tracking random sampling of the local governments, and stage two I use simple random sampling of basic healthcare provision funds enrolled primary healthcare facilities, and stage three I use simple random sampling. I also did kill, where I only I only selected those like the facility managers and the local government primary healthcare coordinators. And this here is my sample size distribution where my Sabon Gari was 128 and I got the percentage of 33.2. Kachi was 132, I got 34.3. Chico was 128 and I got 32.5. My study instrument, like for my data collection, I used structural questionnaire, key informant interviews, and a facility observation checklist. The questionnaire was admitted to eligible respondents, while key informant interview were conducted with the relevant facility and the local government personnel. The observation checklist was also used to assess the availability and functionality of the selected drugs and equipment. And my ethical clearance was from Uniport and also from the local government.
Wrap up. 2 minutes to wrap up. You have not even gone to your results.
So for my results, let me go to my main results. For my main results, for the drugs, the first major finding was that 20% of the drugs allocation had not translated into reliable drug availabilities at facility levels. But during the physical inspection, it showed that 48.7% were available and also in date. For the equipment, only 36% of essential equipment inspected were present and actually functioning. And then the maintenance was not, it wasn't translated into having functional equipment at that time because some were good and some were not good. For my ward development committee, only 28% of the ward development committees were active. 53.8% didn't even know what was going on or they didn't even exist. Like they weren't there. It was the weakest component of my so the discussion is that the problem is not essentially the absence of the funding, but actually the implementation architecture. There were conclusion. The study found that although the basic healthcare provision funds were widely known and the funds were being allocated, the implementation was not consistently translated into reliable drug availability, functional equipment, or effective community oversight in the selected primary healthcare recommendation.
All right. Show the next slide, please.
Yeah.
Dr. Kano. Dr. Kano, over to you.
Okay, please can you go to your title slides? Impact of basic healthcare provision funds on primary healthcare performance. Okay. Okay, so let's see your objective.
They are not saying use the mask.
Okay, so objective one, what are you supposed to do objective one?
To determine the availability of drugs funded, if drugs were actually there, if they were available or not available.
Okay, objective two.
Find out if the functionality of the available were working or not working, like for bed, to see if they're actually there, if the funds that was allocated was actually used for the maintenance of this equipment, if they were working.
Objective three.
People under the word development knew what they were doing.
Objective four.
What the barrier and how they actually were.
Are you in a noisy place? Where are we having all this noise now?
Not me, ma'am.
So, manage to
It's not me now.
The objective 4 is identify by
Sorry, sir. Sir?
objective 4 identify barriers and facilitators.
Sorry, I didn't get you, sir.
I said objective 4 barriers.
I cannot hear you, sir. Hello?
Dr. Kanu, please speak up. Can't hear you again.
Yeah, I said objective 4. Are you there? Can you hear me?
Yes, sir.
You are looking at barriers and facilitators. Then objective 5 effects.
The effect on the community members and the access to the quality of primary health care system.
Okay, so let's do quick on your work now. Go to your objective 1. Let's see how did you determine the availability of drugs? What did you use? What instrument and how did you determine that? Let's see your work.
Where is it, sir? Hello?
So what does this table stand? What does it
Okay.
stand for?
The first
Can you
table.
explain how does this one tell you the availability of drugs?
Okay, sir. So first of all, I did a tracker drug. I asked what were the drugs that were in use, drugs that were available for these funds, drugs that these funds actually they use these funds to get. So apparently for the malaria, yes, but for the lowest was for the ORS because it was the least available at that point.
So how do you determine availability? How did you work out availability? That's my question.
Okay, so I used an observation checklist.
Mm. So what will you measure? And you now say something is available. Is it if you have one tablet, you have one pack, you have 10 packs, you have this? How do you determine availability?
Okay, sir. So first, it's according to how many packs that were there, like how many stock up were there, how many stock outs actually. So for like the malaria, we had 8. The ORS, we had 7. Somewhere like 1 or 2 were expired. Some for the.
So, so what I want to know, when do you say something is available? Is it if you have, you see, there has to be what in your methodology, what method did you use? Did you say maybe if there is at least, if you want to use that, at least 1 dose, 2 dose, 10 dose, 10 pack, whatever, it means that drug is available. Do you understand what I mean?
Yes, I
There has
understand.
to be a standard way of assessing whether something is available or not available. So what did you do in your methodology to determine? Or is it if you find any pack of anti-malaria, then anti-malaria is available, even if it is one? What did you do?
Yes, sir.
What did you do?
Yes, it was any like I calculated the percentage of what I saw if it was available or not. So it was based on what was in the physically, it was a physical inspection was based on what I saw there, what they had that I used to get my percentage.
You didn't answer my question. I said, did you say if you now have one pack, 10 pack, whatever, then it's available? You have to
Yes,
establish a pattern. Do you understand? There has to be a pattern that says this is what availability means in definition. So, did you have a definition or you did not have?
I had a definition.
What was your definition of availability?
It had to do with not the dose, but the packs that were available.
So, how many packs makes up availability?
Close to 10. If there was up to
But there's
10.
nothing like close to 10. That's why I asked you whether you have a definition. You said yes. Now you are guessing. Do you understand?
I
Eh?
understand, sir. But
Yeah, if you didn't have, listen, if you don't have, just know that you go back to your methodology and go and use standard method and now put it that, oh, availability in this sense means if you have so and so, if you have at least so and so, it means that that drug is available. So when you start going, you now say, okay, once you see one or two, it means available. Even if you see 100, it's available. You see 1,000, it's available. But at least you should see this number.
it was
Then you say it's available. That's what I mean.
yes, sir. It
Do
was
you understand?
yes, sir.
If you didn't have that, you should go back and do it.
Yes, I
Go
have
to your second objective. Let me see where you did it. Because
second objective:
so what's your second objective?
equipment and infrastructure functions and functionality if they were functioning.
Okay, so what? How did you determine when you can say that there is equipment and the equipments are functional? How did you determine that?
Okay, sir. So basically, there are like functional equipment and non-functional equipment, like the fridge, those that were working well, those that needed repair, those that were broken, those that weren't even available. So they were not present. So
What was the minimum equipment level? That's why I say everything study has to be standardized. You cannot just do anything you like. You just have to come out with a standard. You set the goal before you start the match. You come out with a standard and say, this is how we are going to go about it. Once you have this, it means that equipment is available. Once you have this level of functioning, it means that infrastructure is working. If you don't have that, then your work will not, it will just be hazy. It's not having any concrete, you can't hold it, you can't reproduce it. Do you understand? Eh? Do you understand? You have to come out with standard measurements, standard procedure, things that determine whether something is there or not. It has to be there in your checklist, in whatever you are doing. Eh? So here now, how did you know? You said refrigerator 4, delivery bed 6. What if you
yes,
come?
it was based
You
on
have,
10.
do you understand?
Yeah, I understand you. It was based on
Hmm.
10. So in my whatever I see that if it's up to 10 and it's
That
like
based on 10, is it standardized? Which reference value do you have?
so that's the
Or
thing. There's
is
no
it
reference.
arbitrary? Is it arbitrarily assigned that it must be 10?
No. The thing
How
is
did you
that the
arrive at
topic
10?
yes, sir. So the topic is not it's not everyone that has done it. So basically in that particular I didn't see any, so I had to do mine.
Okay, so in your methodology, did you put down there that every center must have up to 10 refrigerator before you can say it's available?
So in the word yes, but in this one I didn't put it. That's the issue.
So you cannot use it as a criteria. That's what I'm telling you. That what you lacked in your work, you did not standardize it. Your study tool was not standardized, so it cannot give you an appropriate measure. Anything I'm mentioning here is that if you like, you can say if you have one fridge, it's available, so it's working. If you like, you can say if you have two. Do you understand? But if you set out with standards, now it becomes easy for you to really assess the facility and say whether this thing has an impact. Because without the basic healthcare provision fund, the center could have had maybe one refrigerator or two. But you could say with the basic healthcare provision fund, every center should have a minimum of maybe 5, a minimum of maybe whatever. So you can use that to now assess whether that basic healthcare fund is actually having impact or not. Do you understand?
Yes, sir.
Uh, that's what we did not do. Because this your data now, we cannot really present absence. If
Actually,
something is one, it means present. It cannot really,
but
you cannot really
in
ascertain
the work
whether it's even due to.
when I was doing it, it was 10. I was if I see 4 out of 10, that was how I was doing it. 10 because of we know Kaduna is not a very well developed state. So what
You how can you see
See,
10? How can you see 10 in
presenter,
rural
you
area?
can't say so.
Eh?
What is
You can't
expected
say
is
like
what you
that.
should go and do. Use a
Eh?
standardized tool or
standardized?
define your operational definitions that you're going to do for this study. If you're going to
Yes.
say for this item, a minimum of this, or you look for the standardized tool that may be already available that saves you all this headache. You know what they are looking out for availability, and use it. If you don't find it, you say if they scored it in terms of fairly available, somewhat available, it's on a scale like
So,
that,
ni
then you
na ce
know
apart
what the
from that, sai
scale
na ce
is.
ku je ki samu mai
Okay.
Beatrice wanda tana yin wannan din so da ki
So,
shaida mata you are going
so
on.
you should go back and redo it so that it can standardize your work. Otherwise, nobody can assess you properly.
Okay, sir.
All right, so stop sharing. I think we've had enough time to. Then your design